Imagine something, maybe just floating in a pond or even like in the dirt. And then imagine that causing a really serious, sometimes devastating illness in our pets. Sounds kind of wild, doesn't it?
It really does. The natural world holding secrets like that.
Well, today we're doing a deep dive into a condition called protothecosis. We've got some pretty detailed veterinary resources here.
Yeah.
And our mission is basically to unpack this, figure out what this disease is, who the culprit is, which is really unexpected, by the way. See who it affects, where it comes from, and, what happens if an animal actually gets it.
And that culprit you mentioned, definitely not what most people would guess.
Right. So what are we actually talking about here? What is protothecosis?
Well, fundamentally, protothecosis is caused by these tiny single-celled organisms. They belong to the genus Prototheca.
Okay, Prototheca.
Yeah. And here's the really fascinating part. Digging into these sources, they aren't bacteria. They aren't fungi. They're actually a type of a chlorophyllous blue-green algae.
Algae, like actual algae. But a chlorophyllous, what does that mean?
Right. It means they lack chlorophyll. So unlike the green stuff you picture in a pond, they don't photosynthesize. They don't use sunlight for energy.
Huh. Weird.
It is weird. But biologically, they're classified as algae. And these specific types, they've adapted to cause disease in warm-blooded animals. That includes us humans, and also cats and dogs.
Okay, disease-causing algae. That's definitely surprising. So how does it actually show up? I mean, in our pets? Because I gather it's not the same for dogs and cats.
That's a key point from the sources, yeah. The presentation is dramatically different.
So let's start with dogs. What does the picture look like there? Sounds like it can be pretty serious.
It often is, yes. The material points to the gastrointestinal tract being commonly affected first. You typically see chronic large bowel diarrhea.
Okay, chronic diarrhea.
And often with fresh blood in it, which is, always a worry.
Yeah, definitely.
But it usually doesn't stop there. Dogs tend to get severe weight loss. They become really debilitated, just generally very unwell.
That sounds awful, but kind of non-specific too, initially.
Exactly, which can make it tricky. And then here's where it gets really alarming and often progresses rapidly. It can cause acute onset blindness.
Blindness? Suddenly? Oh.
Yeah. It's often due to inflammation at the back of the eye, chorioretinitis. Sometimes the retinas can even detach. It's quite devastating.
Wow.
And on top of that, neurological signs are a real possibility. Things like deafness, seizures, difficulty walking, like ataxia, or even weakness, paresis.
Goodness, so it can go systemic and hit multiple organs hard. Any other signs?
Yes, you can also see skin lesions, things like ulcers or crusty areas,
Right.
especially on the paws or around the mouth and nose.
Okay. And do the sources say if certain dogs are more likely to get this severe form?
They do mention a signalment, yeah. It seems young female adult dogs, particularly medium to large breeds, are overrepresented.
Any specific breeds?
Boxers and collies are specifically called out as being at higher risk.
Interesting. Okay, so that's the pretty grim picture for dogs. What about cats? You said it was different.
Very different, yes. First off, protothecosis is much less common in cats overall, much rarer.
Yeah.
And when it does happen in cats, the sources say it usually presents as a more localized issue, typically on the skin or mucous membranes.
So not the systemic problems like blindness or neurological issues?
Generally, no. Cats usually show few, if any, systemic signs. It's more about what you see on the surface.
Like what specifically?
You might see chronic ulcers that just don't heal. Or sometimes these large lumps under the skin, cutaneous nodules,
Yeah.
often on the face or the limbs.
So still problematic, obviously, but maybe not as immediately life-threatening as the dog version sounds.
That's a fair way to put it. It's a significantly different clinical picture compared to the disseminated disease we often see in dogs.
Right. So this algae, where does it actually come from? How do pets even encounter it?
That's a great question, and the environmental connection is quite interesting. These sources point to its ecological niche being in some maybe unexpected places for a pet disease, like raw and treated sewage, for one.
Sewage? Seriously?
Seriously.
Yeah.
Also as contaminants in water, soil, even food sometimes. Let's kind of go look around. They even mention it can sometimes be found in fecal samples from perfectly healthy animals.
Huh. So how does it get in to cause disease?
The most likely route, according to the material, seems to be traumatic inoculation.
Meaning?
Meaning it probably gets into the body through some kind of break in the skin or mucous membranes, a cut, a wound, maybe damage to the gut lining if it's ingested. Something lets it bypass the normal barriers.
Okay, that makes sense. Are there different types of this Prototheca algae?
Yes, there are species differences noted. Protothecosis is usually the one causing the more severe systemic disease in dogs, and interestingly, also in humans with systemic infections.
And cats.
Cats and also human skin infections are more commonly caused by different species, Prototheca wickerhamii.
Okay, different species, different disease patterns. What about risk factors? Does anything make an animal more susceptible?
That's another key difference highlighted. For dogs, and also humans, the sources suggest that having a depressed cell-mediated immunity might predispose them to getting those really bad GI and disseminated infections with these ophi.
So an immune system issue makes them vulnerable.
Potentially, yes. But here's the interesting contrast. For cats, even though P. wickerhamii is the usual cause of their localized form, the sources state there are no known predisposing factors.
Really? So it just seems to happen in otherwise healthy cats sometimes?
Apparently so. It's one of those things we don't fully understand yet.
Okay, given how weird this is algae causing disease, often severe disease, how do vets actually diagnose it? You mentioned routine tests might not pick it up.
Exactly. That's a major diagnostic hurdle. Your standard blood work, your CBC, biochemistry, urinalysis, they often come back completely normal or maybe show nonspecific changes.
So you could miss it easily if you weren't thinking about it.
Very easily.
Yeah.
That's why you have to actively look for this specific organism if the signs are suspicious. And the definitive test, the go-to, according to these sources, is cytology.
Looking at cells under a microscope.
Precisely. Taking a sample from where you suspect the infection is maybe a scraping from the colon, fluid from the eye, cerebrospinal fluid, or aspirating a skin lump and examining it.
What are they looking for?
They're looking for these characteristic algal cells.
Yeah.
They're unicellular, they don't have pigment, they're often oval or round, and their cell walls can look a bit folded.
Okay.
But the real giveaway, the aha moment for diagnosis, is seeing endospore formation inside the cell, specifically internal divisions or septations in two planes. It looks like little compartments forming inside.
Like the cell is dividing internally in a specific pattern.
Exactly that.
Right.
And they often use a stain, like Graham's iodine, to help see that structure clearly. Finding that confirms Prototheca.
Right. Are there other ways to diagnose it besides cytology?
There are. Cytology is often the quickest way to get a definitive answer, but you can culture it, grow the organism in the lab.
How's that done?
You need specific media, usually blood agar or Severdod's dextrose agar, but importantly, without cyclohexamide, which is often added to fungal media but inhibits Prototheca. It grows pretty fast, usually white or creamy colonies within about 48 hours.
Okay. Any other methods?
Yeah, PCR assays are also mentioned. They could identify the specific Prototheca species from various samples like biopsies, CSF, or even urine. That could be useful too.
But the main takeaway seems to be suspect it, look for it specifically, and cytology is key.
That sums it up pretty well. Don't rely on routine tests alone.
Okay, so let's say this difficult diagnosis is finally made. Can protothecosis be treated? And I guess what's the outlook, the prognosis?
Yeah, treatment is definitely discussed, but the sources are quite frank about the challenges. And the prognosis, well, it varies massively between dogs and cats.
How so? What's the general approach?
For dogs, with that often severe systemic disease, the approach is usually trying a combination of things. If there's a localized mass, surgical removal might be attempted, but then it's typically long-term drug therapy.
And for cats, since it's usually localized.
Right. For cats, surgical excision, cutting out those skin nodules or ulcers, is considered the primary treatment. And if they can get it all, it can sometimes be curative.
Okay. What about the drugs used, especially for dogs?
Several are mentioned. Amphotericin B often comes up. It's an antifungal, but it has activity against Prototheca. There are different formulations, and sometimes it's combined with other drugs like tetracycline or amikacin, maybe for a synergistic effect.
Does it work well?
It's used particularly after surgery for localized disease, and it's noted as having some effectiveness for the eye problems. But it's a tough drug with potential side effects.
Any other drug options?
Yes, azole antifungals like ketoconazole, fluconazole, itraconazole are also used, sometimes with amphotericin B, sometimes alone for maybe less severe cases. And then a few others get a brief mention, like clotrimazole used locally, especially for the P. wickerhamii type common in cats, or even potassium iodide. They even mention specific treatments for the colitis, like amphotericin B cream or clotrimazole given as enemas.
So options exist, but how effective are they really?
That's the tough part. The sources state pretty clearly that the infection is very difficult to completely eliminate with drug therapy alone. They actually say there's no definitive therapeutic protocol. It's often the case of trying things and managing the disease rather than curing it, especially in dogs.
Which brings us to the prognosis.
No.
You said it was very different.
Extremely different. For dogs with systemic or disseminated protothecosis, the prognosis is described as guarded to grave.
Guarded to grave. That sounds really bad.
It is. One source mentions a median survival time after diagnosis of only about 4 months.
Wow, only 4 months. That's incredibly sobering.
It really is.
Yeah.
But then you look at cats with the typical cutaneous form.
Better news there.
Much better, comparatively. The prognosis is considered fair to good if, and it's a significant if, those skin lesions can be completely removed surgically.
That difference is just stark.
It truly is. Same underlying type of organism, vastly different outcomes depending on the host and the form of the disease.
So wrapping this up, what does this all mean for you listening, whether you're a pet owner or maybe working in the vet field?
Well, I think the main point is that even though protothecosis isn't common, understanding it is really important because it's so easily missed.
Right. For vets, it needs to be on that list of possibilities, that differential diagnosis list, especially when you see a dog with, like, chronic diarrhea that isn't getting better or weird weight loss.
Or those really scary, fast-progressing signs like sudden blindness or unexplained neurological problems, particularly in those breeds we mentioned, like boxers and collies.
And for pet owners, it's maybe a reminder that if your pet has puzzling symptoms, things that just don't add up or aren't responding to standard treatments, it's worth digging deeper with your vet, considering these less common, maybe weirder possibilities.
Definitely. Knowing the potential source, water, soil, and knowing how differently it can look in dogs versus cats, that can help guide the diagnostic process.
And remembering that key diagnostic point,
Yeah.
you have to look for the algae cells, usually with cytology.
Exactly. And while treatments exist, we have to be realistic, especially for dogs with systemic disease. These sources really emphasize the challenge and the often poor prognosis there.
Okay, so to quickly summarize, protothecosis, it's this rare but potentially severe disease caused by algae, actual algae, believe it or not, presents very differently. Often severe systemic disease in dogs, usually localized skin issues in cats, comes from the environment, water, soil, even sewage.
Diagnosed by finding the organism itself, typically via cytology.
And treatment is tough. Prognosis often poor for dogs with widespread disease, but better for cats if the localized lesions can be surgically removed.
That covers the key points well.
So as we finish this deep dive, here's something provocative to chew on, something that really stands out from this material. Think about how common these organisms are supposed to be in the environment. They're in water, soil, sewage, kind of everywhere.
Right, ubiquitous.
Yet something so common can lead to such a devastating, hard-to-treat disease in seemingly healthy animals. And that huge difference in susceptibility and outcome between dogs and cats. What does that tell us?
It really makes you wonder, doesn't it, about the complex dance between these environmental microbes, the specific genetics of the host animal, and how their different immune systems respond or fail to respond effectively.
It definitely makes you pause and think about the hidden world around us and its surprising potential impact.